I used to do a lot of American drug policy reform conferences, and I remember some of those great people over there saying, Andrea, when you go home, you tell them not to look west. You keep up with your harm reduction programs and all the rest of it. And I used to think, yeah, right, okay, whatever you say, I'll do it, yeah, sort of thing. And now we're in a situation where if I was over there, I would be saying, whatever you do, don't look east, which is really fucking depressing, right? Right? And in the past, when we've actually got our shit together, it was because of HIV. And I think that was about it, actually, wasn't it, in this country? You know, it became the silver lining by which, you know, people like me could get clean work, so I didn't have to go robbing the A&Es and so on and so on. So because now we're in a situation where, you know, we've got this, you know, we've got a million problems going on, you know, that are all down to, as far as I'm concerned, as an Occupy activist, it's down to the globalisation and corporatisation of the world, okay? But we're not going to get into that because it's too big. So I'm going to suggest, right, that certainly where the user community is concerned, we pick one thing and just focus on it, whether it's Hep C or getting the lockstone out to our peers, and be really focused. Because I think, you know, when we, I don't know, I'm looking at you all the time, because over the years, we've really followed gay men, haven't we? I mean, you know, because we've been fighting for our lives and we didn't have a politicised group. You know, and on the issue of politicisation, right, you know, this whole business of fighting with the whole recovery network, some of those people can be politicised, right? I've been part of that community on and off for many years. And if you can politicise people who've got an abstention background, you have got a bloody good harm reduction worker. You know, when I was in the States, and all the good harm reduction people actually came from a 12-step background, or at least a lot of them did. So I suppose what I'm trying to say is, you know, please don't don't look at them and let's start a fight. Look at them and think, what is the potential there? Because actually, you know, there really is some. And, you know, just ignore their discrimination. I mean, tell them they're, well, don't tell them they're arseholes, because that won't start a conversation. But you know what I'm saying. Okay, so, yeah.
What you're asking me, understandably, is what is it that we need to be doing, and possibly what single issue should we be focusing on to get the harm reduction agenda elevated to where it should be again? Yeah. Is that kind of... Yeah. Can I ask the panel to contribute? Since she was looking at you, do you want to kind of start on that?
I got into trouble about 5 years ago with some HIV activists, really big trouble, because I'd been working around chemsex for about 10 or 12 years before there was any measurable harm. It was just guys feeling like shit on Monday. But when we started to see the HIV rates rising, I got hooked up with these HIV activists, and I said, I don't actually give a toss about your HIV, but it's getting me the ticket to get some attention to this. They forgave me eventually. Well-being, I think it's not about HIV and it's not about hepatitis C, it's not about death, it's about well-being, it's about having the entitlement to an awesome life and enjoying it and having good relationships, having good inner well-being and self-esteem and good childhood experiences in school, good preparation for sex and romantic lives as we go into them, and how to look after ourselves, how to empathise with other people and how to communicate with other people. Well-being, to summarise it, that's the focus that I have. I've been fortunate. At 5016 Street, my job was, one, to address chemsex, and two, to rebrand the clinic from a sexual health clinic or a CLAP clinic to a sexual wellbeing centre. Wellbeing is a word I like.
Thank you. Any other comments from the panel in terms of how we might take harm reduction forward? Any kind of thoughts? You're going for it.
Thank you. I think I agree with you, it's well-being. But I think in terms of what I've been very focused on the past few years, it's about choice and personalisation and making decisions about what your recovery means to you, rather than having a politician or a police officer or a teacher or a parent impose their idea of what recovery is. And I think we've lost that completely. We've stopped treating people who come in for help as human beings and started to treat them as boxes we tick in order to achieve political objectives. And that just makes me furious.
And that's to do with the privatisation of services, which is back to the bloody corporatocracy again. Get me off this mic.
Okay. On that, that's a useful... Does anybody want... Sorry, Magdalena, you want to offer something?
I think you raised some really great points, Andrew, and I think the recovery movement has has got a lot of really great stuff in terms of, mutual aid and things around empowerment that we can learn from. And I guess my dislike of what's called recovery is mainly in terms of where the government's going with it. Payment by results. Absolutely. And I think, gay activism, is absolutely fantastic. We've got a huge amount to learn from it, and I would love to see more of a politicisation of the drug-using community, more community empowerment, but that needs to be supported and well-resourced. And, and again, the well-being thing, helping people deal with everyday traumas, having their children removed, things that are meaningful to them, attending to pragmatic needs, vein care, things like that. This is my sort of, attending to what people need, which may not be about wanting to stop injecting immediately or, and accepting that. Just accepting where people are at and giving them the services they require with compassion and non-judgment, and this is where we're seeing the deaths, because people are being forced out into the street, they're being forced off scripts, they've got nowhere to go. So I think there's a multitude of issues here. There's no one simple, easy answer, but I certainly don't want to see this, us versus them. We've got a lot to learn from each other, but it's just unfortunate the way the drug policy has been, the rhetoric around the drug policy, and, as with all movements, there are some hardline recovery people, who, so there's all sorts of issues there. Yeah, anyway.
Thank you. A question, can we have the mic at the top, please?
Hello, Marios from Positive Voice from Greece. It's not actually a question, it's just I wanted something to say from all the things I've heard till now, because it's a very interesting experience for me. I'm working for a harm reduction platform. I'm an ex-addict. Now I'm 3 years sober without substitute or medication from a public rehab program of Athens. We're talking about addiction. I wanted just to mention that addiction comes from a Latin word called additarem. The addictum in the Roman Empire was a man enslaved for his debts. So now in Greece, we are 11 millions of addicts in that sense. We are enslaved from our debts. And that makes our life really miserable according to harm reduction and according to an effective drug policy. Dr. Frank before mentioned scapegoatism. Actually is to blame the victims for the condition of the society. That's what now is happening to Greece. The vulnerable communities are under severe attack now. And not only that, but the public rehab programs are under severe attack, not only for austerity measures, but for political as one. They have political aims to abolish the public programs, because the public programs have an emancipatory character and they're trying to promote private things. The last thing they have to say, it's another thing that I have to agree. It is that we're actually, when people talking about addicts, talking about sick people. We are not sick people. There is not this kind of pathology, and I don't accept that. This is the general trend, the dominant trend in Greece, that we are sick bastards, excuse me for my language. And because we are sick, we have to get methadone lifelong, or buprenorphine or we have to go to strings. I'm sorry, but I'm without anything for 3 years, and it's not only me. But doctor, if you had my parents, you could actually want to talk about your childhood in your string, because you mentioned that before in your speech. Okay, that's all. I thank you, all of you. It was a great experience for me being here.
I absolutely agree with my Greek brother. I just have one suggestion, respectfully so. When we think about people in recovery and we think about folks who have not used drugs as yourself for 3 years, I just want to ask folks not to start with that statement, because it implies that it's an important behavioral outcome. It really is not the important behavioral outcome. The behavioral outcome that's important It's how well you're functioning in life, as opposed to whether you use the drug or not. Because I haven't been, as they say, clean in 25 years.
Just a thought. I think harm reduction is stuck in the 1980s. It's far too entrenched in the heroin zone, and that obviously the money goes there because it's a public health issue. You know, the government don't want people spreading horrible diseases amongst normal people, so they throw a load of money at it. There's obviously zero money spent on harm reduction for the general population, recreational drug use, and I think that's where harm reduction needs to go. It needs to get out of the 80s and get into 2014 in a way. What do you reckon about that?
Just want to talk about the difference between harm reduction for psychostimulants and harm reduction for opiates. I feel in the UK we're a lot more on board with harm reduction initiatives that focus on opiate drugs. You know, I'd really like to see us come up to date. You know, if we look at other countries in Europe that do things like safer sniffing kits, they give them out openly at festivals. I can't even imagine getting away with doing that at a festival. We're not even allowed to put up harm reduction or two harm reduction posters. We have to kind of hide the harm reduction advice, and this is what's really dangerous. So it feels like we're going massively back the way at a lot of events that I'm working at, and there's only a few events that actually let us come in and deliver harm reduction orientated services. So I agree with you, we're back in the dark ages.
I just have one question for Carl. Carl, what has been like the most controversial conclusion you've come to in the studies that you've done that kind of conflicts with the beliefs around drugs?
So as I said, I've given thousands of doses of drugs, and so I don't know which is the most controversial. To me, all of it is I shouldn't say it's not controversial to me. It's controversial to people when I say, "Oh, what do you do?" Well, I give crack cocaine to people every day. So that's controversial to people. But when I think about the findings, the thing that people might find controversial is that before I really started studying drugs, I had no real interest. I mean, I dabbled, but I had no real interest. But then after studying drugs to solve this problem that society has, to rid the society of this scourge, when I started studying drugs, at the study after study, at data after data, the conclusion I came to is that, you know what, we should be using these things to harness people's potential or to enhance people's potential. That's the conclusion that I have come to after 25 years or so of studying this. Some people might find that controversial, and then other people, like governments, for example, don't find it controversial because they do it with their militaries. So many of these drugs, they use these drugs in the military to enhance the functioning of soldiers. And you know what? It's smart.
I think we need to be leaving there. I'm mindful of time, and I need to invite Pat down to conclude the session. I mean, it certainly leaves me with a sense of, one, the discussion we've had, that one, we don't need to be excusing ourselves anymore. It's been an absolute pleasure being amongst people without having to justify what we do and how we do things. But it's also made me realise we need to start thinking a little bit differently and be more open in the harm reduction terms. I think there is good argument that our argument has been stuck. We do need to shift things forward. So thank you for your contributions, everybody. It's been remarkable. Pat.
Thanks, Danny. Just a quick bit of housekeeping. This is the ticket for the cabin if you're coming tonight. It's on the back of this, so please bring it with you. I just want to thank you all. I want to thank you. I want to thank our panel, our chairs. I want to thank John. I want to thank my colleagues at HIT and their friends who came along and packed bags yesterday. I think it's been a great conference, but I'm biased. But I'd want to pay you a second-hand compliment. It didn't come from me. We were standing on the HIT desk, and a man came up and said, "Are you the organisers of the conference?" So we said, "Yes." He said, "Oh, I'm the director of FACT." So this is the big boss of the whole place. He said, "I just want to tell you that this has been the best day we've ever had in 7 years of the existence of FACT." And he said, your people at this conference are wonderful. And he said, "I've been listening to conversations." And he said, "The level of engagement with the subject matter is quite incredible." So I think that's just a wonderful compliment to you all. And thank you very much again. And I hope that we all see you again 12 months from now. Thanks very much.